Thanks, Scott, for that story. President Trump returned to the White House this week after being diagnosed with the coronavirus. Was it the right move? Joining me now to discuss is pandemic expert Dr. Dean Grayson is back, and author of his new book, The Ultimate Manual, Dr. David Samadi. Dr. Samadi, they moved him from the hospital to the White House after 3 days, 72 hours. Your thoughts on good move, bad idea, good idea?
Well, you know, as a clinician, you always want to keep the patients in the hospital for as long as it's necessary. And, you know, apparently his symptoms were absolutely stable. He had no fever for 72 hours. You know, he's still under 24-hour, 7-day care by the doctors. So I think it was perfectly fine. The move from the White House to the hospital, Eric, was absolutely the right move because he looked dehydrated. His O2 saturation was going down. They had to you know, be prepared in case they need more CAT scans and other issues that they don't have in the White House. But I think so far he's been asymptomatic. His vital signs are stable. His O2 saturation is holding very well. And it seems that, you know, so far so good. He's still not completely out of the woods yet. We need to monitor him, and we'll see over the rest of the next week how things are going to turn out.
And Dr. Dina, your thoughts on the move?
Well, I thought it was appropriate that Trump was moved to Walter Reed Hospital. It was pretty clear that he was decompensating actually rather quickly and, you know, was in a situation where he may have needed to be intubated and put on a ventilator. So I think that was absolutely the right move. And look, if Mr. Trump is no longer requiring supplemental oxygen and his other vital signs were stable, I think it also was appropriate that he was discharged and allowed to return home. Having said that, it's also incumbent upon Mr. Trump, though, to protect others from him while he's at the White House by wearing a mask even while inside. And unfortunately, that doesn't appear to be happening. So my concern at this point is, yes, for Mr. Trump's health. As Dr. Samadi said, you know, Mr. Trump is not out of the woods by any stretch of the imagination. Unfortunately, he could take a turn for the worse. I think the rest of this week in particular is quite crucial for his overall recovery.
So let's start with you, Dr. Samadi. There are many ways to diagnose a patient. One of them is, you know, their temperature. Another is, as you point out, the O2 saturation. Another one being, how does the patient look? Now, in your estimation, and look, this is an important tool in the doctor's, an arrow in the doctor's quiver. How does the patient look to you?
To me, clinically, the way he walked out of the hospital was excellent. And you know, it's rare to see a 3-day recovery so fast. The good news about the president is that he's not a smoker. His lungs are great. He doesn't drink alcohol. His liver and kidneys are fairly good. And so, you know, I agree that if over the next few days his saturation stays stable, if he has no fever, you know, he would get tested. And if it's negative, then he's recovered from this. You know, the mainstream media made a huge deal about when he was on the balcony and took his mask off. And let me just make a little comment about this. I think that he understands the seriousness of this disease. He knows that it's fairly contagious. And I'm sure when you're around other people, he needs to wear the mask, and he will. But if he's standing on a balcony all by himself with nobody around him, and there's a wind blowing, the risk of like taking the mask off and giving this virus to other people is extremely low. He's trying to send a message to the rest of the country that we can defeat this virus, not by being careless, but don't panic because our medical treatment has improved. We have best healthcare system in the world. And it's amazing how the mainstream media is saying, like, if he took his mask off and now people are getting this infection all the way in other countries. It's outrageous.
And Dr. Dina, there are a lot of people who have complained, and I've been on shows where they're complaining about the treatment he got. He got a cocktail of drugs that included experimental drugs that aren't on the market yet. Do you have any problem with that?
Well, look, I don't have any problem with the fact that he got the experimental antibody. I actually predicted ahead of time that he would receive the Regeneron or similar Eli Lilly product. He is the president of the United States. The risks to him were relatively low, even though that's a completely unproven therapy. I also predicted that if he decompensated further, that he would be treated with remdesivir. I think that was the right move. Having a decade of experience developing antiviral drugs similar to remdesivir, you know, the earlier you use those drugs, the better they work. The one thing I do question was the use of dexamethasone. Now, what that suggests is, you know, that drug is really only shown to be effective in people who are really, really critically ill on a ventilator or heading to a ventilator.
Right.
So I do question that. It's not clear why that drug was used in Mr. Trump.
If I may, very quickly, Dr. Samadi, you got in a little bit of trouble on Twitter for mentioning hydroxychloroquine about a half a minute or so. Tell us what happened.
Basically about a week ago or a few days ago when the president got diagnosed with this, I basically wrote that he's 74-year-old, mental status going to 50. Wish him well, and I'm sure his doctors are going to be very aggressive with remdesivir. And I wrote HCQ, and that key word is a major trouble for Twitter, and they banned us from being on Twitter for a week. As you know, Eric, I've been in media for almost like 13 years. I was on Sunday House for 10 years,
right.
Now with Newsmax TV. And to censor doctors talking about medications, I didn't say he should be prescribed or anything like that. It's outrageous. The censorship is just crazy.
I got to leave it there. Dr. Samadi and Dr. Grayson, thank you very much for your time. Big topic.
Thank you.